Hello, my name is Elizabeth Mutubuki. I'm a scientific researcher at the RIVM and currently working on research on long COVID. However, my background is also in physiotherapy, where I've worked both in practice and also in research. My research in physiotherapy has focused mainly on low back pain, treatments, costs, and health effects. Thank you. I'm very delighted to share my thesis with you today. Please forgive the English. We're still expected to be mourning the Queen. So in my thesis, we looked at the interaction of low back pain with treatments and with societal costs. So as we know, low back pain is highly prevalent. So about 80% of the population will suffer an episode of low back pain at one single point in their life. There's so many ways in which low back pain is described. It is described based on the location and whether it's specific or not. But however, the burden of low back pain remains tremendous, also for individuals and for societies. As we can see on the map, the yellow, orange, and red areas on the map represent areas that have a high burden of low back pain. And these are measured in disability-adjusted life years. And in the Netherlands, the cost of low back pain is equivalent to a north-south metro line. And that is 3.5 billion euros per year. How many metro lines could we have? Yeah, I don't know. But and this is equivalent to 0.6% of the gross domestic product of the Netherlands. So when low back pain persists for a long time, it leads to disability. And disability has implications on productivity and absenteeism. And this in turn leads to high societal costs. And so in our thesis, we aim to address these different issues that relate to low back pain. So in theme A, we looked at the relationship of low back pain with outcomes and costs. And in theme B, we looked at whether treatments were effective or not effective. And in theme C, we explored the methodological studies. However, the methodological studies will not be part of this presentation. In theme A, the relationship between low back pain was longitudinally assessed with health-related quality of life and costs, and we also explored risk factors of high users in low back pain population. And what we found is that both disability and pain were longitudinally associated with higher costs and poor outcomes in health-related quality of life. However, disability had a higher impact on quality of life and on societal costs. So disability resulted in worse outcomes than pain. And again, when we conducted the prediction model, disability stuck out again. Again, here we see that disability is an important component in low back pain, and perhaps interventions towards disability might be worthwhile. In theme B, which was the main part of this thesis, is we looked at the effectiveness and cost effectiveness of sciatica treatments. And for this, the PLUS study was set up, which is the prevention of lumbar disc herniation surgery, to assess whether combination therapy was effective in treating sciatica. To do this, the PLUS study recruited 7 hospitals and 4 outpatient clinics. And the aim of the PLUS study was to see whether combination therapy does indeed reduce the amount of surgeries in sciatica patients on the waiting list for surgery. Sorry. So the combination therapy consists of mechanical diagnosis therapy and transforaminal epidural steroid injections. And whether a patient received only MDT or TISIS depended on what their pain patterns were. So some patients only had MDT and others had a combination of the two. So what we did is we included patients that were on the waiting list to receive surgery, and we randomized these patients to either remaining on the waiting list and receiving usual care or receiving combination therapy whilst they were on the waiting list to receive surgery. And what we found out is actually that combination therapy was promising in reducing the amount of surgeries for sciatica patients on the waiting list for surgery, as only 9 out of 27 patients randomized to this group did not or received surgery, and the rest did not, whereas in the surgery group, a higher population, 24 out of 29 received surgery. However, the story was different for secondary outcomes because there was no difference between the two groups in terms of pain, back pain, leg pain, or physical function, which suggests that the differences that we observed are not necessarily associated to just combination therapy alone. So in conclusion, what we really wanted to put emphasis on is that disability is an important aspect when it comes to quality of life in low back pain patients, and perhaps interventions should focus more on disability.